Hello, everyone. My name is Rupali Sharma, and I am a CSPC Program Committee member. On behalf of CSPC, a very warm welcome to everyone. We're about to participate in a very exciting conference session with the code 244 titled Communications for Living with COVID-19, Engaging Diverse Populations, which is organized by the Canadian Association of Science Centers. Before we begin, a couple of housekeeping notes. For all audience members, please turn off your videos and microphones while the panelists are speaking. And please also note that this session will be recorded. Please don't forget to tweet about your favorite events and panels at the conference using @SciencePolicy and hashtag CSPC 2020. In the chat box, I will be adding the links for a short survey that should only take a minute or two to fill out at the end. You can fill this survey out at any point during the session, and I encourage you all to please do so to help make CSPC better in the future, especially as we're navigating this new online medium. So without further ado now, I'll pass it over to Dr. Sarah Gallagher, who is the moderator of this session. Thank you.
Thank you so much, Rupali. It is my pleasure to be here. I think we have a fantastic session set up for you, and I'm really looking forward to hearing what our panelists have to share with you today. So before we get started, for this virtual panel, we are joining you from across Canada, and we would like to acknowledge traditional lands accordingly. From London, Ontario, I acknowledge the Anishinaabe, Haudenosaunee, Leapawuk, and Adirondack peoples from whose traditional lands I'm speaking to you today. So first, I want to set the stage for this panel and how it came about and what our goals are for speaking this. And I'll briefly introduce our panel, and then we have a short poll before we get started with the first questions. So the way this panel arose is that in the spring, as you all know, we had the initial just urgent crisis of the initial onset of the first wave of the pandemic. And I was a part of the COVID National Rapid Response Research Network, which was established by the Office of the Chief Science Advisor in order to bring together the research community to respond to the pandemic in short order. As in the very early stages of the pandemic, it became clear from watching the interactions on the platform and what people were becoming concerned about that there was an issue around communications, and in particular that we were moving into a phase where instead of responding urgently and dynamically to a crisis, that we were moving into a phase where we really needed to get ready for the long haul, and it was going to be quite a while before the vaccine was going to be available, and we needed to sort of shift gears into thinking about how we were going to live with COVID, how are we going to live through the pandemic, and how different communities who were feeling very disparate effects from both the public health measures as well as the infection itself, how we could respond in a dynamic way to the experiences of these different communities. And so we crowdsourced a briefing note on communications with many of the panelists that we have today. That was one of the techniques we were experimenting with on CanCOVID, were crowdsourced briefing notes. And we brought together some principles that we felt would be important for communications. And so I revisited that panel, that briefing note, and I think it's useful to think about where we were. So this was in June of 2020. So one of the statements from the briefing note was that Canadians need effective communications to equip them with the knowledge, habits, and public norms that will keep them safe in a sustainable manner. And also one of the recommendations was the content will evolve as circumstances in a community change and the scientific understanding advances. And one of the recommendations was co-development with different communities of strategies and communications, and that the agility would really be a key factor. And so some of those initial thoughts are still valid and are still sustainable, but the situation has changed dramatically, as we all know. And right now we're in the middle of the second wave, and we need to take different things into account. We can see what's happened over the past 6 months and look forward into the next 6 months and figure out a better way of managing this pandemic and communicating with all of the different types of communities that have been so affected. So our goals for this panel are really twofold. One is to give our audience a snapshot of the reality on the ground in different communities across Canada. And the second is to share the knowledge and some best practices and practical advice on how to communicate most effectively. And our panel here is really talented and has a lot of on-the-ground experience and some fantastic insights to share with you. So I'd like to briefly introduce them. We have Dina AlKhooly, who's the Director of Research and Evaluation for Visions of Science. So if you could just, there's Dina. We have Cari McIlduff, who's the Indigenous Community-Based Health Research Lab, who's based at the Indigenous Community-Based Health Research Lab at Morningstar Lodge. So welcome, Cari, it's good to see you. Tracy Calogneros from the Canadian Association of Science Centers. She's the board president and CEO of the Exploration Science Center and Museum in Prince George, British Columbia. Welcome, Tracy. And Cécile Rousseau, who's a physician, and she's the director of the Transcultural Child Psychiatry Clinic in Montreal, at the Montreal Children's Hospital, and a leader of the Covivra communications effort also in Montreal. So welcome to all of our panelists. And before I get started with questions, we have 3 brief polling questions so we can get an idea of what our audience is looking for from this panel and to give us some context. So the first question is who's in the room? So please identify who you are. And you can choose, if you have more than one hat, choose the one that is the one that's relevant for this panel here today. And these polls will be up for about 30 seconds. And we should have our second polling question popping up. So sorry, here's the answer for it. So we have actually a really nice mix between government employees, scientists, researchers, and science communicators. It's pretty even, and other. And so that's interesting too. So that is good for us to know. And then we have our second polling question. And we'd like to know what you were most interested in learning about. So, and again, you'll have 30 seconds to vote. So policies and solutions that are needed to support building partnerships, co-developing strategies for living with COVID-19, how to address the expectations that recommendations will change over time, and concrete examples of communications tools that are targeted to specific communities. So we have really fantastic expertise on the panel right now, so they can help with all of those. They can address all of those issues. So we'd like to see what. So let's see. We have a clear favorite is concrete examples of communications tools that are targeted to specific communities. And so our panelists all have really great examples that they can definitely share with you. So that will be a focus. And the second one is policies and solutions that are needed to support building partnerships. And we have one final polling question for you. And so that's what mechanisms do organizations and departments use to communicate with diverse communities? And this is, so these are the typical methods. So we have social media, in-person engagement, local media, such as newspaper, radio, TV, community events, or other. And so this is for just to see what are the techniques that people are using. And it looks pretty balanced, actually, in terms of, so social media is certainly very, very high, but in terms of the other ones, it's pretty even. And I imagine many people are using more than one technique to reach different audiences. So thank you so much for participating in the poll to give us some context for our responses. So I'd like to start with Dr. Cari McIlduff. And so, Cari, could you please set the stage for us? And let us know what is the lived reality in the communities you work with, and how have you addressed it in your communication strategies? And also, as you're thinking about it, what is missing or inappropriate in some of the public health communications that you've witnessed as well?
Yeah, absolutely. Thank you so much. So, I mean, we all have a different perspective, which is the beauty of this panel. My perspective is definitely from an Indigenous perspective nationally, but I know that others will share from more provincial perspectives. I'm just going to acknowledge the fact that I'm actually on Treaty 4 territory speaking to you today, the traditional territory of the Cree, Nakota, Lakota, Dakota, Saulteaux, and homeland of the Métis Nation, and just recognize the leaders past, present, and future. And I'm just honored to be able to be here today. My boss is a Métis woman and offered me up for the panel as she's so busy, essentially responding to COVID. So I guess the question is around lived realities and communication. So a lot of the communication that's out there is very specific to, first of all, English. Second of all, the medical language. I do work a lot in partnership with doctors, medical doctors up north, particularly because they're being hit quite hard. And the way that they speak about COVID and access to services to respond to COVID is a very high language. And oftentimes that shows a power imbalance, or for those that are not understanding of that language, there is a bit of there's a feeling of power imbalance, which often leads to a feeling of not feeling culturally safe or not feeling good enough or worthy enough to understand. And then oftentimes there's a bit of a wall that goes up. I mean, we've definitely seen that in a lot of our communities, particularly around some of the policies that have been put into place with roadblocks and checkpoints, the stigma around having COVID, distance to access healthcare centers, or even isolation. So a lot of families are dealing with overcrowded housing or dilapidated housing and can't isolate. But I think the main thing that I really want to push across, and I think most of the panelists will agree, that we really need to focus on not just what we're sharing, but who we're sharing it and how it's being shared. So I think in the poll, what was said is, or what was put on as a specific concern is partnerships. And I think that's key. So I think particularly for Indigenous peoples who have a history of not trusting government entities for various reasons, there definitely needs to be some information sharing that's done through trusted sources such as Indigenous organizations like Morningstar Lodge, the Assembly of First Nations Health Authority, or other trusted organizations such as science centers across the nation. Yeah.
Thank you. I really appreciate that. And certainly we'll be returning to you to get more insight on from your perspective. But I want to give Dina a chance to talk right now. So Dina, from your situation working with youth through Visions for Science in Toronto, you're dealing with a lot of people on the ground in community housing in Toronto in an urban environment, so quite different from the environment in which Cari is coming from. So what is your strategy and how are you finding it is most effective to engage youth and families?
Yeah, for sure. So I also want to acknowledge that I'm logging on from Toronto, which is covered by Treaty 13. These are the traditional lands of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And to answer your question, Sarah, or to kind of speak to it a little bit, Visions of Science is, for those of you who don't know, a local organization that provides STEM opportunities in these social housing communities in the GTA specifically. And when this first kind of popped off, we really didn't see our role fitting super clearly into this COVID communications world. We really were just thinking about our programming and thinking, oh my God, we're not going to be able to provide programming in person anymore. So we thought, first of all, we don't know what our priorities are right now. So the first thing we did was actually do a community needs assessment with our family. So we actually physically called 350 parents and guardians of participants to kind of get a sense of what their experience was right now, what their challenges were, and if they would be interested in even continuing engagement with Visions of Science and as it relates to STEM education. And what we found were people were really concerned about their immediate needs. So things like their groceries weren't stretching as far because their kids were home all the time. Childcare was a huge concern. Being able to work, a lot of them had lost their jobs. They weren't really that clear about what the government benefits were and who qualified for them. So that was a lot of the transition work that we were doing early on in the pandemic, was just connecting them to resources that they would be that they would qualify for. And then we tried to do a short virtual engagement with our participants that didn't, I mean, it was really, I think, impactful in terms of preserving community, but in terms of the STEM learning piece, that wasn't really our priority at the time, just because so many people were kind of explaining social isolation as being their primary concerns and not knowing what to do with their kids. So that's what we were doing early on. We've had this summer to kind of go back to the drawing board and define a strategy that makes sense for our mandate and in the context of what we're dealing with right now. So we asked our parents in the registrations for this upcoming program that starts this Saturday, what their biggest concerns are right now. It's been kind of 8 months since we first called them. So we're obviously thinking that a lot of the priorities have shifted. And what we found is actually COVID-19 safety was the #1 response that families were, and even youth were saying that is their biggest concern right now. So it's interesting because this idea that these communities don't really care, or they're not really taking it seriously, or they just don't understand the guidelines, maybe. We actually haven't been seeing any evidence that suggests that. We're actually seeing that they're very concerned about the virus and about the well-being of their families, and for good reason, because they're living in the communities with the highest cases. A lot of them are essential workers. A lot of them are living in multi-generational homes, and they're also, like Cari mentioned earlier, they're living in buildings where it's practically impossible to physically distance or socially isolate. So what we're seeing is that these communities are already kind of on board. They want to do what's in the best interest of the safety of their family. So I think what we really, I would like to see is kind of a shift away from this focus on trying to convince people to care or to comply with guidelines, and more towards a focus on actually building the knowledge and understanding of the science to really empower communities to make decisions that are evidence informed and that make sense in their context.
Thank you, Dina. That's really helpful. I think it is important to see that from the experience on the ground, and I could see Cari nodding as well when you were talking, is people know what they're supposed to do, and in some cases they're just not able to, and that we need new solutions in order to keep people safe that work for the context in which they're living. So now I'd like to turn to Tracy, and from her situation as somebody who is an executive at a science center. So we know that in Canada, science centers are the primary source of informal science learning. They reach up to 10 million Canadians a year, which is quite remarkable. And given this role, how do you think they fit into this dynamic in terms of the communications and also into reaching diverse communities?
Thank you for that, and good morning, everyone. Tracy Calogneros. I am the CEO at the Exploration Place. I'm also the president for the Canadian Association of Science Centers. I guess I'm past president now. We just had an AGM. I'm speaking to you today from the traditional and unceded territory from the Lheidli Nation, a member of the Dak'kaq language in the Cari-Arthapascan language group, in what today is known as Prince George, or the regional district of Fraser Fort George. So to answer your question, science centers, you would think, would have been poised, ready to leap into all of this. And we were caught as flat-footed as everyone else when this really hit in March. It was interesting that both our local communities and nationally, people turned to the Science Center network and to the individual science centers and museums that are in their own communities. So you talk about science centers in a normal year reaching 10 million people. Since the shutdowns that happened around March 13th for most of us, that actual interaction and communication number has gone through the roof over social media. So science centers may not have been prepared for the immediate turn of Canadians to them for information that they would trust, but they pivoted very quickly. And so we found that all science centers were offering digital engagement almost immediately. When we closed on March 13th, that was right at the start of British Columbia's 2-week March break period. We had camps fully booked with kids that were coming into care. We had a whole slate of public programs and special events planned. Obviously, everything was canceled. And that social isolation that Dina mentioned that parents were feeling was the first area that was easy enough for science centers to step into filling that void. So we were doing Facebook Lives and YouTube Lives and reaching out to communities at the same time as we were also trying to understand the science. Science centers and informal learning have taken on a very important role right across the country since their inception 50 years ago. And I think Canadians need to recognize how lucky Canada is to not only have a strong science culture in our country, but a mechanism that exists in the Science Center network for reaching Canadians fast and with information that they trust. It was 2016 that the Ontario Science Centre did a national survey looking at public levels of trust in science centres and museums, and we outscore everybody. People turn to us looking for information that's unbiased, that they can trust, and that helps them to understand the level of complexities that there are in today's various existential threats to humanity, whether we're talking about COVID or climate change or the social injustice. And it's centers like these that exist in virtually every community that offer that interface, that place where the public feels safe and confident in what they're being told and able to come in and ask questions that they might be embarrassed to ask or not sure where to place those questions. So I do think that it's important that people recognize that Canada and more broadly science within Canada is definitely seen at a high level when you start to talk to my international colleagues. So the Canadian Association of Science Centre, as well as Canadian scientists, are being held up as examples for the world. And we need to find a way not only to get that information out beyond our borders, but to our own citizens. And I passionately believe that that doesn't start at 18 or 38 or 50. That has to start in the cradle, and it starts in our galleries, and it starts with our programs, and it is something that needs to be properly resourced and acknowledged right across the country, that we have this built-in source, this built-in mechanism to reach Canadians. We need to fund that in a way that allows that work to continue and to formalize the partnerships, whether we're talking about research grants, having a communications component as part of the requirement or part of the deliverables, or even just the ability to reach scientists at an educational level and teach them about informal science communication. Because if Canadians don't understand what we're doing, they're certainly not going to support the funding that's necessary. And then we're right back into the mess that we've seen ever since COVID has rolled out across the globe.
Thank you, Tracy. That international context is really interesting, that we also make sure that we don't beat ourselves up too much, but looking at the bigger picture is pretty important. So Cécile, now I have a question for you. I've been lucky enough to work with Cécile on a communications project in Montreal, and she has taught me a ton. And so her research is very diverse and covers lots of areas. And she has some really interesting insights on how the second wave response has been in different communities within Montreal. So Cécile, could you please share with us some of the insights from your work and how it's affecting how you think we need to respond or change our response in terms of the second wave, particularly to majority communities?
Thank you, Sarah. So first, I want to acknowledge I'm talking on Mohawk language, and I'm also talking in English, which is kind of our common language. And I think it's wonderful that we have a common language. But I want to apologize because it may not be the first language or the maternal tongue of all of you. So this is about relations of power among us. So thank you for, yes. listening to us all in English. But you can ask some question in French. Unfortunately, not in all of the other languages, which we certainly would like to acknowledge also. Yes, to come back to your question, Sarah, I think that in terms of communication, we have taken for granted that the acute stress response that we had during the first wave, where in fact people were first afraid and very protective and bought in very well to confinement rules, was going to hold on for the whole pandemic. Now, this is not what we know about stress response when it becomes chronic. We want to kind of survive a chronic stress response, we have to move to strategy in which we minimize the stress in order to go on with life. And I think that this is in our space, being evidenced through conspiracy theory, minimizing the virus, denying the virus doesn't exist, the virus is just like a usual flu. The virus won't touch me, so more magical thinking. And kind of constructing protections through avoidance. And I think that now we have, for the second wave, to change our communication strategy to address that. Now, if you give me permission, I wanted just to jump on what Dina was saying before, that the fact that we're not equal in front of the virus. In fact, some of our Canadian communities, minorities, have been much more affected. And to what the audience was asking us, concrete examples. Do I have time for a little concrete examples? Okay, so in terms, how do we have to change our communication models for people who are touched more in terms of exposure to the virus, discrimination, and collateral effect? I'll give you 3 examples. So the first one is about language, and of course it looks like obvious. We have been transforming the letters to schools sent by public health agency in Montreal because they are too long and you almost need a PhD to be able to read and understand them. So they're very legally okay because from a legal perspective, they're okay. Now, no families in the neighborhood I work in are able to understand them. And they're in French or English. Families there, not only they're not fluent in French and English, but they may not have a basic level of literacy, which is very high, and they may not have any numerical literacy. So we've been translating these big letters into one-pager with pictograms and no reference to, well, there is a reference to a website for example, being tested by COVID, but a lot of people don't even have the web or the internet at home. So you also need to have a direct address. Where is it? How do I go there? Who can I call? As a first example. A second example is about socioeconomic effect. So as Dina was saying, yes, people from marginalized community, minority community want to endorse and enforce social distancing and protection against it. Now, if you work in essential services and you come back to a 2-bedroom apartment and the laundromat is a block apart, can you wash your mask every day? You just have one mask and the laundromat is a block apart, so you may not be able to wash your mask. So how can you teach, for example, how do you wash a mask in a glass of water in an effective way? This is addressing context. Our rules are done for middle-class family who have kind of a washing machine in the house. This may not be the case for a lot of families. And finally, the last example is about culture. We had and worked a lot with Jewish community during the first phase because what we enforce, for example, for us, majority hairdressers are important. Now, for some Jewish Hasidic community, it's the mikvah who are important, which are the ritual baths. You have to use once, women have to use one time a month. And I think that considering that hairdressers are more important than mikvahs is really kind of a majority blind spot. And are the mikvah more dangerous? We as majority will say yes, but after examining the situation, actually, really with public health agency, we concluded that no. So working with other groups is also acknowledging that majority priority should not always prevail. Thank you.
Thank you, Cécile. And I'm so glad Cari has her hand up because I was going to ask her anyway. I know that Morningstar Lodge has done some really fantastic, culturally appropriate communication. So please, I hope that you're going to share some of that with us.
Yes, thank you. Thank you so much, Cécile, for really hitting hard on the context. We really need to be aware of the context. So as she was explaining, like washing your mask is not a reality for a lot of people on a daily basis. And I kind of touched on a few different things when I first was talking about the reality on the ground. We were kind of in the same space that Dina and Tracy were in, where at the beginning we were just trying to figure out how we were going to work, not being able to be in communities because it wasn't safe for them or us. And then what the communities had asked of us is to try to explain what was being put out there. Like Cécile was saying, they were like, you have to have a PhD to understand what was out there. And we also created one-pagers. There's a couple of one-pagers, one on the facts about COVID-19, which explained good ways to wash your hands, because I know that there's a lot of people that don't know very thorough ways. Only because I did nursing training for a while, I know a very thorough way of washing my hands, but that's not common knowledge. And then we did blogs where we did videos of the proper way to wash your hands, or ways that you can avoid touching surfaces. We did some like foraging fact sheets to keep people busy. Like both Dina and Tracy were touching on, families didn't have access to sending the kids to school. I mean, some families don't have access to internet to access some of the services that people are putting out there. So we did a bunch of different fact sheets. Both there was one that we ended up doing because there was an outbreak after a wake around how do we grieve during COVID. We're being told we can be with 10 or 20 people socially distanced, but how do we do that in a community where there's quite a bit of loss and there's quite a bit of vulnerability to both the virus, but other diseases. So just making it really contextual, it was kind of our mandate. And we worked with La Fida Madeleine, we worked with the Canadian Virtual Hospice, and a few of our other community partners. We translated into 7 different First Nation languages. And I guess that's kind of what I was touching on before about partnering with trusted sources. It's not something that we expect that health authorities or policymakers think that we expect them to know how to make this information into lay language so that people understand that there are people out there that can be partnered with, that are trusted, that are being asked for the information that could definitely support in that area.
Thank you, Cari. So Dina, I would like to return to something that you said when we had our preparatory communications in order to prepare for this. And you mentioned the fact that, I mean, we've talked, and Cécile brought this up as well as Cari, that it's really important that communications are in lay language, but that shouldn't be, sometimes that's referred to as dumbing it down, which is really inappropriate because that's not what it is. It's using non-technical languages for concepts that can be quite complex. And so it is important that we acknowledge the intelligence of the people that we're working with. So Dina, could you comment on that, what your experience is with working with families in these communities, and what's the appropriate way to acknowledge people's intelligence and yet not use language that's alienating and opaque?
Yeah, so thank you so much for bringing that up. I have found in my experience in science that there's a huge disconnect between the approach of science research and then how science messaging ends up being relayed to the public. So where researchers are usually very careful about their limitations and drawing concrete conclusions from their data, when that trickles down to the public, it ends up being super rigid, sometimes overconfident, sometimes even distorts what the evidence is even suggesting. And I think that, so something we'll see is science shows that blah, 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 instead of these researchers found that there's they did this and then this happened, or researchers found that in this data set, this was the kind of relationship. And I think when you frame things in ways that are super simplified and super rigid, we lose in two ways. And the first way is that, number one, we lose the opportunity to build a healthy sense of skepticism and discernment in the public, which is going to be super important long term. And number two, we leave ourselves open to people discovering holes in the science. And I want to say discovering holes like this because it's not actually a hole, but to someone who's kind of been excluded and is now seeing different contradictions coming up, that might seem like something that's a hole. So the common example that's referenced is the mask guidelines changing early on in the pandemic. Someone from outside of science might see that as, whoa, they switched up the guidelines. What's going on? Maybe there's a secret agenda going on that we're just not privy to. There's also been growing scientific consensus around airborne transmission when there was a lot of reluctance and resistance to that early on in the pandemic. And something I saw recently on CP24, which is our local news source here, was public health says transmission is not happening in schools, which is just a gross oversimplification of what's happening. And I think that rigid messaging, it can be effective at securing short-term compliance or short-term assurance that what we're doing, we have things under control. But like so many have said, this is a long-term problem and it's gonna require a long-term strategy. And when we end up kind of delivering these oversimplified and rigid messages, you end up trapping people in that rigidity. So when we require things to be dynamic and flexible, we're not giving people the space to be gracious with us when things change. So really what I'm getting at is people are smart, like give them more credit for what they can understand. They're much smarter than a lot of officials and leaders seem to think. And so long as we are communicating effectively, they can and will understand the science and the knowledge required to make safe choices.
Thank you, Dina. I think that's a really great point. And I know Tracy wants to jump in here, so I'll give her a chance.
Yeah, just a quick reflection on talking about those sources of information and trying to boil it down into something that the general population can absorb when you're dealing with really complex science. The staff on my gallery floors, their job title is interpreter. And they're not interpreting language. What they are interpreting is science and culture and trying to help people feel safe to ask questions that they're going to get wrong answers to. We spend more of our time blowing things up and starting over at our demo desk than we do getting it right, quite frankly. And that's part of the job of science centers. I think we keep circling back to trust. And if you're going to interpret data, you have to trust that that interpretation is accurate and unbiased. And so it's those relationships of trust that have taken decades to build when you're trying to reach anyone, let alone a community like the Clayton here in town that have lots of reason not to trust non-Indigenous source and plenty of reasons to stay right away from us. But our 3 decades almost of relationship building has allowed us to continue to be that source for them. So I really think it's important that we recognize that we have to deal with the existing existential threat in COVID, but there are future ones all lined up ready to hammer us. And so we need to be building those relationships right now. And I again go back to the fact that we have an established network of interpreters right across this country embedded in communities with that trust inherent in the fact that they live there and have grown up there and are educating there.
Thank you, Tracy. That is, I love that, the word interpreter. I think we often use the phrase knowledge translation, and it implies that really you just have to, go from one language to another. Whereas it's more than that. You have to put it in a context in which it's understandable for whichever community is that you're speaking to. So I think Cécile, you wanted to jump in there.
Absolutely, it's a fascinating discussion. In between what Dina and Tracy were saying, I think the whole idea is, of course, I would agree, rigid messaging is problematic because it's prescriptive. And because of the risk, we have tended to be rigidly prescriptive rather, and that goes against empowerment and community agency and people's agency. So the idea is in science communication, we have to acknowledge there is no zero risk presently in front of the COVID, but this is true in our lives. You know, all parents make the decision one day to send their kid to buy a bottle of milk. And it means that day they think the kid is mature enough to go alone and buy a bottle of milk. And if they don't do that, their kid will never grow. So it's the same. We have to provide information that people can, which is understandable, which is accurate. So we can say, this is what we know, but we don't know everything. And we're not totally sure, but in the best of what we know, this is what we know. Now you have to make some choices. This is what we recommend, but you have to balance it with your other priority. Just like in our life, we do risk and benefit analysis today, all the time. And if people feel empowered to do that, the chances that they choose what is safe for themselves and for their family is higher. Whereas if you transmit a rigid messaging, if you say, we are certain, we know, and you don't know, and in fact, you're disproved every day, which is what's happening to experts, you just lose credibility. And people will say, okay, we'll do whatever we wish and not listen to you. So if you empower people to do and to take decisions which are good for them and call into their intelligence, which they have, I think it works far better.
Thank you, Cécile. So I just wanted to comment that we have some questions that are popping up in the chat. We're going to have a talk for a few more minutes and then open up to questions. You do have the ability to vote up a question. So if you see one in particular that you'd like us to start with, then please go ahead and vote it up. Et aussi, if vous avez des questions en français, then please feel free to put them in there. We will do our best to answer en français ou en anglais, depending on who is the most appropriate person to answer the question. So I wanted to return to something that I think is a theme that I think is quite challenging when we think about communications. So on the one hand, Dina brought up that we really want to train people to be skeptical, that's an important quality of scientific inquiry, that you consider the source of information and you evaluate it. But on the other hand, that skepticism, if it's kind of a knee-jerk reaction, can also lead to things like conspiracy theories, as Cécile has mentioned, particularly in contexts where we don't have trust. So I would be very interested to hear each of you comment on how to handle that delicate balance of developing skepticism, but not to the point where it causes people to reject without thought things that are true and have been demonstrated to be important and relevant and scientifically based. So I don't know who wants to tackle that question, but I'd be really interested to hear about your insights on that. Cécile?
I'll jump in. You know, it's one of my passions. I do think that when people become angry and oppose you, before what we've done, and the kind of the gut reaction is often to rectify, verify, try to convince. Presently, I think we have to see that usually this is entering a conflictual escalation, where the more you tell people what you think is the truth, the more they hold to alternative theories. And it can become quite conflictual. We see that in our society with the anti-mask movement. I think we need to go at the root of why is a person in front of me thinking that? What is the underlying affect? So our cognition are linked to emotions. Do these people have legitimate reason to be frustrated, to be angry? And I would say to that first question, the answer is yes. So if you acknowledge that the fact that people can be fed up, can be angry because the pandemic is kind of putting in evidence social inequality, social inequities, It's not fun, it's boring, it's long, it's depressing. If you go toward recognizing this affect, then it's possible to say, I understand you're feeling frustrated with us, with the institution, with the knowledge, with the expert, with all the government who said they're going to solve it, and they're not solving it. And we're still stuck in that. That being said, can you be careful with people who tell you they have it all and know it all and they have certainties? I think that there you can introduce a doubt that Dina was talking about, but it's impossible to do if you don't address the underlying affect, which is, it's just, I had it, I'm sick and tired of all of that. And I think that we should acknowledge.
I'm certainly sick of it. So yes, I think that is that is something we all have in common, for sure. So Tracy, would you like to take a stab at this question? I think science centers have a lot to say about how to develop uncertainty and skepticism in a healthy, productive way.
Absolutely. I think skepticism is just critical thinking in action. And critical thinking is something that all of society needs more of and not less, certainly going forward. And, I've often said that I think part of the problem is that much of the humanities were taken out of elementary schools many years ago. And so we're not giving children at that moment of development a broad overarching picture and the ability to learn how to check their sources, work their way through mistakes that are made and come back and find a solution to those errors. There was it was my daughter actually, who turned me on to a Netflix movie that was on early on in the pandemic called Beyond the Curve. And it's actually looking at flat earthers, but the thread through it is about the fact that essentially we have failed the people that have bought into many of these theories. The amount of effort and pseudoscience that is being invested in developing people's belief in these conspiracy theories really is the scientific process. They've just missed the piece about it being okay to be wrong, and then that fact check and peer review. And so the idea that Canada has this broad-based science culture that I touched on earlier is absolutely true. And it's part of what has insulated us to some degree against the worst of the conspiracy theories that we see developing south of the border. But the fact is, we aren't doing what we need to do at that time in people's lives of education when we teach them that critical thinking is really a key life skill. And so I think we need to address it not just in the elementary schools, but also through informal education areas like science centers and museums and zoos and aquariums. If 10 million Canadians a year are investing their money to come down to those centers, it's because they want to understand that critical thinking approach. And so I still maintain that the networks that we have are the best place to invest that time. But I also think that our traditional educational system needs to be examined in terms of where it's missing the boat. And I do encourage you to watch that Beyond the Curve. It's a very strange process, but there's a number of scientific cafe scientifiques and other things running through it where you have scientists speaking to this phenomenon. And I learned a lot watching it.
Thank you, Cari. That's really useful. I can tell you, as an astronomer, I get lots of emails from people who want to tell me like how the universe is, and that I just don't know what I'm talking about. And it is something that it's important, I think, that we acknowledge that there's a lot of effort and thought that's going into these, and but it is. And it's a shame that we can't. I think it's not a shame. We need to figure out how to redirect that in a way that. To take advantage of that sort of curiosity and interest in a way that can be more productive. Did you want to respond just to what I said?
Just that the non-judgmental piece of that is so important, because people are so socially invested in their network. And so we liberals tend to sometimes, and liberal in the small L broad sense, tend to feel superior or come off as superior. And I think that is a huge problem with the tribalism and the partisanship and the politicization of science that's going on. People don't like to feel stupid.
No, absolutely. And they're not stupid. So I think that's definitely a point, that you need to give people that respect to begin with in order to engage. And it is, I can tell you from my personal experience, I do a ton of outreach. I get lots of questions about how what we know about astronomy and the universe fits into their picture of how things work. And it is very important to be respectful and non-judgmental. So Dina, I saw that you wanted to jump in, so go ahead.
Yeah, I just wanted to add, so we actually started introducing some COVID-19 curriculum with our participants, our youth participants. So these were our high school youth, and they got a chance to interact directly with STEM professionals, learn about COVID-19, and ask questions. And this was kind of the biggest piece because we ran over time almost every time. We had no idea how many questions we were going to get. They were literally exploding with questions. And I think that piece is so important. People across the country have questions, and there might not be an outlet for them to get questions, to get answers that are tempered, that are that really respect the question itself. So things I've been seeing just personally on my social media, the survival rate is 99.8%. Why are we doing all this? Another thing I've seen are the impacts, the economic, mental health, rise in domestic violence. All of that is way worse than the virus itself. And then recently I've been seeing a lot of this vaccine was developed so quickly. Is it going to be safe? So not only are these people like the conspiracy theorists, which I hate to use because I think there's so much stigma that comes with that. But these are everyday people who have questions, and they don't have an outlet to get those answers. So not only are these not dumb questions, these are not dumb people. They're valid questions that deserve to be acknowledged, they deserve to be taken seriously, and they deserve a transparent and tempered response. And when you end up avoiding or dismissing these questions, that's when you push people further and further into the fridges to find a community where they can find answers, whether those answers are mainstream or not. So I think one thing I recently discovered is the REAL resource, so the Rapid Evidence Access Link from COVID. And I think that's such an awesome initiative with a really great format. So they, for anyone who's not familiar, they have questions that are crowdsourced questions, and they synthesize and summarize the research related to each of the questions. And I think super clear what people's questions are, super clear synthesization of the data. And it's just a really accessible format that I think we could be learning a lot from. So just in small ways like that, really acknowledging questions, giving them a tempered response to their questions, we can start to unravel the power imbalances that we're typically seeing in science messaging. One thing that Cécile mentioned in our planning session was that messaging is one way and communication is bidirectional. So sorry to steal your point, Cécile, but I think that piece is so important. And really, if you're answering people's questions, that is moving towards communication. And if you're just telling people the guidelines and paternalistically defining what they need to be doing every day without even an understanding of their daily context, then that is the messaging that clearly isn't being effective.
Thanks, Dina. I wanted to give Cari a chance to respond to the conversation so that we get her feedback as well.
I can't really add to what my co-panel members have said, other than to say, I mean, everything they've said is pretty much bang on. I think what we need to look at it as is the foundation of fear and anger is making people like seek some kind of answer or somewhere to put their anger and their fear. And the first thing that they're doing is usually going to social media. So it's a lack of training for critical thinking with like the excess access to information from whatever source they can access right at that moment. And then, yes, Dina was saying that she has people on her social media that are putting things out there. I think it also needs to be, like she had said, that non-judgmental and tempered response to say, right, but what source is that? Like questioning those sources and seeing if they are peer reviewed, as Tracy was referring to, and just really being humble with them to say, it's not that I know all the answers, I just don't trust that source. Look where that is coming from, and just really helping them to make that decision on their own, instead of sometimes when I'm really angry or upset, like when I have family that have just died from COVID recently, you get really angry. So kind of like the anger and fear that they have, I just want to lash out. But because have a better critical thinking capacity, that I could say to them, right, but have you thought about this? And what about, where is that coming from? I think we really need to be tempered in our responses.
So I think that's a great point. And I think also a lot of medical professionals and scientists are not really equipped with those skills. So I think that is, I can tell you, I'm an astronomer. So astronomers in general, we do a ton of outreach. It's part of the culture of the field. And I'm used to, answering questions from 3-year-olds to 85-year-olds. And I can tell you that some of the best questions I've ever gotten are from, 8-year-olds. And for people who do not have a technical background. But a lot of scientists and doctors don't have that experience. And so I think that that's also something, giving people strategies for how to answer those kinds of questions in a way that's respectful. And also and include that interpretive element so that you give people an answer that's useful and meaningful to them. I think that is something that is really important. And talking about we have a few more minutes and then I'll go to the questions, but I'd just be interested to hear on, we've talked a bit about having trusted partners, and certainly science centers with interpreters you explicitly have people who are trained to do that job of taking technical information and making it make sense without losing its meaning for a lot of people. And we've also talked about partnering with community organizations. So I'd be interested to hear if there are any mechanisms for maybe expanding that training for interpreters beyond science centers. Maybe this is something, Dina, that you've had experience with Visions for Science, or just other, because I think we need more people, and we need to give more people in communities the tools to talk to their families and friends in order to basically share some of this capacity for critical thinking and instilling doubt in, for example, in things like conspiracy theories. So I'm going to put you on the spot a little bit, Dina, because I'd be interested to hear on what you're doing.
Okay, so one thing that we actually just did as a shift for COVID was we started a content development stream for our high school youth. So they're currently working on blogs and short videos that are going to be shared on our Instagram of them kind of explaining what they're doing during COVID. They had one where they kind of documented their research project with the Dunlap Institute for Astronomy and Astrophysics. So I think exploring avenues like that are super important because it's lateral communication. So that type of communication where they're sharing that information with their peers who are going to be more receptive to something that comes from them versus something that comes from the science overlords, I think is going to be super important. And I think it's something that we're trying to kind of build on right now. We just piloted it in the summer, but I think we're looking to expand that and kind of bring in more youth to work on initiatives like that. But I think that lateral piece is so important, especially when it comes to reaching these people who have kind of alternative ways of thinking, because I think, as Cécile mentioned, the more that we as an institution that kind of where you see these power imbalances try to tell people that this is the right way of thinking, the more they're going to think that they're trying to cover up something bigger. So right now we're trying to work on that kind of lateral structure of communication to see if we can get the youth in our program to kind of be the messengers.
Thanks, Dina. So I'm gonna pop over to the questions, and I'm gonna pick and choose a little bit just so that the conversation flows. We've talked about skepticism in terms of how it's important that we instill, as part of science literacy overall for communities, that being skeptical and thinking about where you're getting information from is really important. And this is an aligned issue, but it's a little bit different, and that is how do you communicate uncertainty as opposed to just sort of skepticism. So I'd be interested to hear about that. Maybe Tracy, you could start out with that.
Sure, I think that consistency becomes what's important. So not necessarily that you have the right answer at the beginning, but that your audience trusts that when you realize your answer is incorrect, you'll correct yourself. So that again, it all stems back to trust and an exposure to critical thinking and a willingness to be wrong, and that there isn't sort of a punitive backstory when you are wrong to something. You know, we spent a lot of time, people call it teaching to the test, making sure the kids are going to get the marks they need to get accepted into whatever post-secondary educational institution they're looking at. But we need to be celebrating mistakes, and we need to be rewarding correction. And I think that when you're talking about making sure that people are comfortable with that as an adult, it has to start when they're very young. And again, I go back to not just the schools, but to family settings and informal educational settings. You know, I think back to when my son was very young, and we started off giving him a loonie when he got an A. Well, that became the worst possible motivator because that was all he was focused on. And we spent years trying to undo the damage that bloody loonie did in grade 1. So I think we're faced with that sort of as a species right now. We have spent so much time celebrating right answers that we don't accept that people can be wrong and still have been right up till that point as the new information comes forward. So it's about trust, it's about open communication, and it's about leadership being willing to state that they're wrong and make those corrections, or just say they don't know and this is the best information we have at the moment. But again, all of that stems from those relationships. Our scientists aren't any more infallible than our political leaders or our media are. We have to accept that. If we're not always right, how can we make everybody else always be right?
I think that's an excellent point, Tracy. I'd just like to reiterate that, you know, as a practicing scientist myself, when I first work with students, I also tell them, you know, science isn't this straightforward path where you just work your way progressively towards the right answer. I mean, you try all these things and you get it wrong, and it's this sort of meandering path where you try lots of different techniques, and it takes you a while to actually figure out which one's going to work, and you don't know before you start which one is going to work. And I think also just sharing the process of science, what it's actually like. It's messy and frustrating, and there's lots of failure, is really important. So I wanted to give, Cécile had her hand up. I wanted to give her a chance to jump in.
Yes, just in terms of the literature on uncertainty, is difficult and stressful, but it's not all negative. And it's important to see that uncertainty also means hope. And both are important. So when addressing uncertainty, I think it's possible to share and use history, that there are things that we don't know, but in a situation like a pandemic, we know that we will know. We don't know, we cannot tell you how much time it will take, but we know we are, as human species, able to find the answer to that problem, okay? And we will tell you as we advance. So that's a very simple message, but it means there is hope. We don't have the answer. We cannot tell you now how much time, but there will be an answer, and we will tell you as it goes along. And I think that this is reassuring to people.
Yeah, I think that's a good point, being transparent about the process and sort of where we are along the way. I think that is a really great point. So I have another question from the chat that I think is quite interesting. So I wanted to bring this up. So how much of the rigidity is coming directly from scientists and science communicators versus through the translation of the message by mainstream media and clickbait articles? Could the panel speak to the mainstream media's role in these communication efforts? So I'd be very curious to hear on people's response to that. So who'd like to take the first stab at it?
Well, I'll
Go
step
ahead, Tracy, thanks.
You know, I think they're calling it the infodemic nowadays. And I do think that that's a pretty accurate characterization of a lot of what we're seeing in the mainstream media as well as on social media. And, you know, they used to say, if it bleeds, it leads. And that started in the 80s, I suppose, and it has evolved since then. And that we're seeing the difficulties in the fallout. I think that one of the ways that, at least in the Science Center world, we combat that is that many of our staff are local media personalities in many ways. I know for myself, I had over 65 media appearances from the day we closed until the end of July, which is an unheard of amount of coverage. And yet elected officials, there was almost nothing outside of Trudeau's daily briefings. There was nothing in local media. So again, it goes to relationships. All of the local media have my cell number. They'll call me when they're looking for someone to talk about complicated science, mostly because I think they like it when I mess up and they think that's very entertaining for them. But that approach has worked very well for our community. And so I took that role on. Again, I go back to the notion that if we want good information out there that Canadians are taking in from whatever source, we need to make sure that it's good, trusted information that's being fed into that mill. And mainstream media have so many pressures on them right now. All you have to do is look at their sales departments trying to sell ads in printed publications and the demise of the local community printed paper. They've got pressures on them far beyond just this one discussion point around COVID-19. So I think that if we can make their jobs easy, I write media releases all the time. Pretty much I write them and they run them verbatim. And I think if people start to build relationships with their local media outlets and recognize that they're under all the same time pressures we are, let's give them something that gets the right information out there in a format they can just drag and drop. They'll run it every time. So some of that has to fall back on those who are trying to get that information out.
Thanks. Cécile, did you want to add on to that?
Maybe just because I think we should distinguish in the impact of the media. And there is, I would say, an infodemic clearly. But I think that one thing, the covering that the media does, or I would say traditional media have, I think, done kind of an okay, a decent job during the pandemic. You know, some things are much worse covered than that. And maybe because of people like you, Tracy, but it hasn't been so bad. One thing which has happened is that because of the real-time turnover in the media, we repeat things tremendously. And it's just like 9/11, you know, at the 9/11 moment, kids who were watching the TV saw the tower, 200 towers being demolished a day. And that has a traumatic effect. And I think that the same information said once and explained have a very different impact than the same information repeated 200 times. And there you enter in what is traumatic thinking, which is very circular, non-elaborative type of thinking. And the real-time, quick information has this effect. So I think we should distinguish the content of traditional media, which could be better, improved, and critiqued. I totally agree with that. And I think Tracy explained it very well, from the psychic impact of media exposure, which has to do also with the processes in which news are proposed.
Yeah, I think that's a really good point. I know that I find I have to pull myself back from, you know, doom scrolling, where you just constantly update the negative news, and it has a traumatic effect on you. And so that's I think that's also part of maybe what we need to think about, especially engaging with youth, is how to engage in media and social media in a way that's healthy as well, so you don't wind up with that negative response. Cari, I think you wanted to jump in there. Do you want to go ahead?
Yeah, I think honestly, it's for me, and this has been I guess probably because I've come from the academic world and then worked really in the field and done a lot of that media translation, knowledge translation, that I've always gone about it in the sense of like, keep my friends close and my enemies closer. A lot of scientists see the media as enemies or as the bad guy that is misconstruing information or clickbaiting, or however you would call it. But I think if we keep them closely informed, as Tracy was saying, and I think it does, it rests within the foundation of the previous question around transparency of communication. If scientists are being okay with saying, I don't know, if they're okay with saying, we know this so far, but that was a mistake, and just being really transparent, humble, that where can the media go with that? Other than say that you didn't know, but you already said that. So you're doing the best you can. And like I think you had said, Sarah, around process. Dina made a really good point earlier in this panel that now I've lost her point just because I said it. But that people know they can process a lot more than we give them credit for. Give them the information to do that critical thinking, whether it be through one-page reports, not big, long theses, or through the media that they can process and they can do their own critical thinking. But yes, I've always gone with the motto that I keep the media closer than my friends, because they're usually the one communicating that people are listening to, right?
Yes. So there's a question from the chat I wanted to bring up, because I think this is to some extent might be the elephant in the room, is that part of the reason that we're talking about communications now and all of these important ways is that, and especially with the new announcements in the news, that there's been some really encouraging news about a vaccine, is that we want to lay the groundwork for effective deployment of a vaccine, because as we've said, we're all sick of this, and we want to go back to seeing people in 3 dimensions and interacting in real life. So thinking about that, what communication strategy do you think will be the best as we move forward in the pandemic with vaccines and treatments, and what communication strategies are we laying the groundwork for now that are going to help with this? And then also moving even bigger picture, if we're thinking about things like climate change, where conspiracy theories are a huge component of that, what are lessons we can take from this experience so that we can then translate into thinking about getting people ready for a vaccine effort, and then big questions like how to get people aligned for working on climate change. So who wants to take a stab at that? That was a big question. Dina, let's hear it.
So one thing that I mentioned earlier is that we need to be moving towards long-term strategies, and this kind of rigidity doesn't help us get there. Tracy mentioned that we need to be really investing in education right now. The focus should be on building a population in general that is more science literate. And we can kind of use this COVID pandemic as like a gateway drug into bigger science literacy. And I think in many ways, I've already kind of seen that starting to happen. At the beginning of the pandemic, there was a lot of flatten the curve knowledge building on social media that I've almost never seen before. People using words like incubation period, fomites, if that's, there are so many things that I feel like are already starting to take off when it comes to science literacy. And this is not only our chance to kind of really build off of that and snowball into a bigger piece, but also our chance to kind of write the things that we've done maybe ineffectively in the past, more effectively right now. There was one thing about, one thing I want to mention about with vaccines, I come from a public health background, so I was looking at this very deeply during my learning, and I think it's going to be so important to focus on, and this is kind of another question that I'll kind of talk about now as well. Focusing on cultural and religious communities. There was a big situation with measles in Minnesota. And one of the big issues there is that anti-vaxxers were kind of targeting newcomer Somali communities. And from there, they were able to kind of convince a lot of people to resist vaccine programs. And there was a big measles outbreak, which is extremely sad. And I think one way that we can really address that type of resistance is by going to the sources of people's beliefs and shared values. Religious institutions are a really important point of intervention, I think. I saw a lot of, and this kind of is building off of another question about getting news from back home. My mom was constantly reading Egyptian news and trying to tell me like that we need to be eating this or like take this vitamin. And I'm just like, Mama, what? But that is like, people are gonna really look and lean on their cultural and religious communities when it comes to kind of asking these big, difficult questions. One thing I saw from a local mosque was a lot of using verses from the Quran that kind of support the idea of having to care for your communities, and actually used a verse that said, "Don't travel when you're ill." And I thought that was a really amazing example of really building in people's cultural and religious beliefs into the messaging. And I think a lot of religious and cultural sites are going to be in a really important player to take advantage of and work with when it comes to rolling out these vaccines.
Thanks, Dina. Those are really great examples. Cari, I was wondering if I could ask you, because I bet you've got some analogous ones from your community.
I think, and I'm going to draw on what Dina said again, because we have such similarities in our populations, but previously she had talked about lateral communication. And I love that. I love that in the sense of oftentimes what scientists and our majority culture in Western communities see is that it's an individualist culture and an individualist society. And Indigenous peoples are known to be more collectivist and using those religions or cultures that are all about the collective good, not my good, the collective good, is a huge strength. I mean, that is why communities across the nation have closed their communities to out, or to people coming in. I mean, they still often need to go and get groceries and what have you, but they don't want any outside services in because they're about the collective good. And I guess on that lateral communication stance, we've been working a lot with our northern communities, and there is a lot of stigma around even getting tested for COVID, and feeling like, I mean, there's another example that's not Indigenous, but the Hutterites in the southern of Saskatchewan were targeted a lot because they couldn't isolate, and they were spreading COVID when they were coming into town to do grocery shopping. Again, they have that collectivist mindset. They don't have options to isolate, but we can't target these people. We need to support them. And how do we support them? Well, we raise people on the ground. We train up people on the ground. So there is that form of lateral communication. When we're working with isolation sites, we have health liaisons, and we have local people that are trained up in what's happening, what's coming down the pipe science-wise, and so that they can talk one-on-one to their community, to their grandma, to their auntie, to their cousin, because that lateral communication is the trust. That's our string of trust that we really need to grab hold of tightly.
Cécile.
Yes, I totally agree with Cari and Dina on the importance of lateral trust and communication. Now, I will raise a point which is a bit difficult. I think that we as scientists are certainly hold a big share of responsibility for the distrust that people had toward pharmaceutical and toward vaccine. We have covered, and it's evidenced in the New England Journal of Medicine and so on, for years and years and decades. We have covered unethical behaviors from the pharmaceutical, like non-publishing negative result, like interpreting kind of findings in an outstretched way because of profit, because of economy. So I think accepting lunches and travels and so on from pharmaceuticals. So you have a collusion, and it's very clear and it's very well documented between clinicians, between hospitals, between the health system, between scientists, between researchers who have also been paid by big pharma, and between big pharma. And so the fact that people say, now we don't believe you, is just healthy. I'm sorry about it. And we're very responsible for this distrust. So the idea, yes, I agree with Cari and Dina, we should build trust within community. I'm going to work on that for this new vaccine, because I think people should take it. But you see, there is, I think, a broader question is, if we don't want people to distrust us next time, how do we also have to straighten ourselves? Because we're not so trustable.
That's a really great point. And I think also it speaks a little to what Tracy said earlier about the downplaying to some extent of humanities in the schools, because, you know, I mean, ethics is a big part of that. And when we pull science out of the context of you know, that broader understanding of how it fits into society and really incorporate values into it, then you get dangerous situations like this where trust has been battered because people have behaved unethically. And so I think that that is it fits in nicely with what Tracy said. So we're down to the last 10 minutes. So Tracy, I'd like to give you an opportunity to say to add into our conversation so far before I wrap it up.
Yeah, I just think, spinning off a bit from the conversation we were just having, I think that consistent messaging at all levels of understanding is going to be really important. I mean, we can talk theoretically about how we're going to deal with future issues, but the fact of the matter is there's a lot of vaccine hesitancy out there, and there's a lot of misinformation out there already. So in order to get the biggest population vaccinated right off the bat, we need to figure out how we're going to tackle that communication strategy. And I really think that it has to be national in scope. And that's why I turn to organizations again, like the Canadian Association of Science Centre. They have this built-in network, this ability to create consistent messaging and pull from real data in order to be able to get information to real Canadians. And then I would suggest that really we've got three different groups. We are going to preach to the choir, those of us who are going to be first in line to get that vaccine the minute we can get it. You've got the anti-vax movement, which is definitely not going to be first in line, and we will have trouble even getting them into line. But then you have this large group in the middle that has this hesitancy around this particular vaccine because of the speed at which it's been developed and other things they've seen in the media. That's the group I really feel like we need to target. And I think we can do that by enlisting the group of the believers we have already. That group we would preach to the choir, let's take that choir and turn them into ambassadors and empower them to be the ones convincing family and friends that these vaccines that are coming out, hopefully in the very near future, are going to be for the betterment of everyone. So I would suggest that that's the area that we need to look at, and we need to really look at national messaging in a way that's going to be consistent and believable and transparent.
Thank you, Tracy. So we have answered all of our questions. And so I'd like to sort of synthesize what I think some of the takeaways are from this session. So I think one of the themes that is coming over and over and over again that is so important is the issue of trust. That when we're having hard conversations, when we're trying to convey complicated information, it is extremely important that the messengers are trusted. And this could be, and I think there's been lots of great examples of who can be a trusted messenger. So certainly community organizations that already have deep relationships, those are great examples of trusted messengers. family and friends, these lateral means of communication. That's another source of people who can be trusted messengers. And then institutions such as our science centers that already, again, have deep relationships within our communities are another example of trusted messengers. And so these are existing networks in many cases, but it's really important that there is a connection and that they also have the support to actually fulfill that role. And it is the case that it's not always the case that there's a natural way for them to fulfill that role. Science centers, for example, are not getting they're not getting that income from people coming to the physical building anymore, but yet they're playing this really essential role. And so it has to be recognized that these important mechanisms are really supported. And so that's something certainly to think about. I'd like to bring up something that I think came through is how important emotion is. And I think it's important in lots of different ways. So there's the point that Cécile brought up, which is that people are having an emotional response to a really difficult situation. And it's important that we acknowledge it. We're all feeling this emotional response, but it's important that we acknowledge it and also work with it. But I think there's another emotional response, which is related to the power imbalance in many cases, where people can be made to feel stupid or ashamed for not knowing. And it's really important that those emotions are not invoked, because once that happens, then your ability to communicate just goes out the window, because that negative emotional response it really inhibits communication. And so in both of those cases, acknowledging people's fear and anger about the pandemic situation, and also avoiding creating a negative emotional response to being made to feel inadequate in some way, those are really important. And then I think we heard lots of really fantastic examples of communications that were culturally safe and appropriate and also relevant. And then we also had a couple of great examples of problems that need to be solved. I mean, if people only have one mask and they need to wash it every day and they don't have access to a laundry machine, I mean, that's a problem to solve. Let's figure out how to do that and let people know how to do it. And I think that's one example, but there's lots of these things which are problems that people want to figure out how to solve them. And we've got lots of intelligent people, and let's put our minds together and figure out how to solve these problems to make so that people can act in ways to protect their families and their communities. And then I think the final point that, again, has been reiterated over and over again is that it's really important that we treat people, we treat everyone in this in our communities as intelligent and capable of understanding complexity and uncertainty. And that we start with that position where we treat them, we assume that they are able to understand this, and then we give them the tools so that they can do that. We give them the tools so that they understand, they develop skepticism, they learn how to evaluate different sources, and that they learn how to handle uncertainty. And in the same sense, it's really important that those of us who are in a position where communicating to other people are humble about our knowledge, acknowledge mistakes, acknowledge that the process is challenging and we don't know all the answers, and that it is something that's going to evolve and change over time, and that rigidity just has no place in effective communications. So I would like to really thank our panelists who have brought such exciting and really deep insights to this conversation. I'd also like to thank Marianne Mader, who's the Executive Director of the Canadian Association of Science Centers. She did all the heavy lifting to bring this panel together, and I think she really did a fantastic job and helped us a lot in our initial engagement. So yes, thank you so much to everybody, and thank you also to the Canadian Science Policy Center for hosting this panel. I really appreciate it. I think they have a survey that they would like you to fill out, and I will stop here. So thank you all so much for your great questions and for the panelists for contributing all of their insights.